very sick. Was about to die.
That very bad pain.
Very bad.
And how did it start? Did you do something? Or?
I was in washroom and I was just when I came back from there. Pain was I was not even able to stand for a single moment. I directly lay down on the bed, and that time I was literally crying. Yeah, I would say in pain, having 90% of relief,
Yes.
and and I can easily walk. There's no some numbness.
There is some
in-
numbness.
Yeah,
Yes,
in
yes,
left leg, but yeah, I'm feeling good.
So I have a patient. I want to introduce to one of my patients. What is your good name, my friend?
Yeah, Abhishek Dubey.
Abhishek. So my friend Abhishek was suffering from which leg pain?
Left.
Left leg. Since how long you have been under our treatment?
Yeah, recently because of some injury, it started 45 days ago. But yeah, because I'm having this slip disc problem from 5 months ago.
Okay. So for 5 months you were having slip disc, but because of the injury it aggravated.
Right.
And it started. We were under the treatment for almost maybe 2 months, something like that. One and a half months.
One
month.
month. Yeah.
But how? But when you came to emergency this time, the pain aggravated like anything, right? It was when? At like 3 days, 4 days back.
Yeah, 4 days maybe. Thursday.
Thursday. How much
Today
pain?
is-
What kind of pain you had on Thursday?
Very sick. Was about to die.
That very bad pain.
Very bad.
And how did it start? Did you do something? Or?
I was in washroom and I was just when I came back from there. Pain was I was not even able to stand for a single moment. I directly lay down on the bed, and that time I was literally crying.
Crying with me, because when we were told in emergency that you need an emergency admission, and we admitted him, and then we started giving IV medicines and tried to conserve the problem by giving medicine. We wanted to subside the pain, and for almost 2.5 to 3 days we kept on giving very high dose medications. But did it really help you?
Actually, very less.
Very less.
2-3%.
2-3%. You were not able to move in bed, even with all the drugs we gave you. So after that, finally we decided that the medicines are not helping him. So we decided that let's go for the next step. And yesterday we did his endoscopic spine surgery of L4, L5 area from the left side. So now you tell me, how do you feel after the surgery?
Yeah, I would say pain, having 90% of relief,
Yes.
and and I can easily walk. There's no some numbness.
There is some
in-
numbness,
Yeah,
yes,
in
yes,
left leg, but yeah, I'm feeling good.
You're feeling good. And tell me, people would have already told you that endoscopy is a...
Yeah, actually a lot of people. One of my friend was
Yeah.
saying that I'm suffering from this problem from last 5 years.
Yes.
And because of people say this is very dangerous and
You should not get it done.
But yeah, because I gone through a lot of videos of yours and others also.
Yes.
So then I decided better to suffer with this pain, go with this endoscopy.
Then to just suffer badly. You were not even able to move in bed, I remember.
Very from last 4-5 days I was in very bad situation.
Yes. Because I remember, when you were shifting him to the operating table, it took us like 10 minutes to shift him from one table to another, because the pain was so much that he was just not able to move.
Very.
And what was the experience just after endoscopy? How was your experience just after?
Yeah, actually, after endoscopy, I was in anesthesia, and yeah, you tested that LSR test.
Yeah, straight leg raising
Yeah,
test.
so that was negative
Yes.
that time. So I was a little confident that I am okay, and I was easily.
You were feeling that things were going
Yeah.
to get good. And when you walked today, were you able to walk before surgery?
No, not at all.
Even turning sides in the bed?
No, even not with support. Of
Not
people.
with support.
I was not even go to washroom.
Okay. Now you are able to walk.
Yeah, no.
So just one very small thing, because this video will be watched by many people. Do you want to give an advice to people who are suffering with this kind of pain and still avoiding surgery because they believe it's a very dangerous thing?
I mean, whosoever is suffering, I mean, because most of the, I mean, obviously when I visited doctor, he said we'll see with medicines, and then we'll go with the procedure. We'll not go directly for the surgery. But yeah, if it is needed, then we must go for this. And obviously, your surgeon will advise you. And because I visited Dr. Devashish Sharma, so I mean, my experience is very good with him. So yeah, that's really nice, and I'm feeling very better.
Thank you so much. Thank you so much, sir.